Hi, my name's Simone Aspis, Free Our People Now campaign and advocate. As you might expect, trying to get people with learning difficulties out of psychiatric system during a coronavirus pandemic will be challenging, particularly when public services have used the pandemic to delay assessments, locating appropriate housing options, and working with care providers. On top of this, psychiatric hospitals are using their powers to compulsorily medicate inpatients with dangerous antipsychotic drugs indefinitely in order to secure long-term compliance. Over the past 6 months, the government's public bodies and individual psychiatrist hospitals have used COVID-19 pandemic to negate on their duties to monitor and promote inpatients' well-being. I have undertaken policy reviews to help lawyers threaten hospitals with judicial review action if they do not withdraw blanket policies of banning all Section 17 leave for patients during national lockdown. This is leave to go in the community. Just before application to court, hospitals tend to withdraw their unlawful policy, leaving inpatients Section 17 leave intact. We are having again with another national lockdown. Will hospitals start banning all visitors? And where does this leave lay advocates like myself? I am sure we will find out soon. No doubt another judicial review case threatening with the need to force hospitals withdraw more unlawful blanket policies, this time around visitors' visits. Changing Perspectives and other disabled people's-led organisations began legal action against the Care Quality Commission announcement of cancelling all inspections during national lockdown. This is at a time when inpatients would be prohibited from having external visitors and therefore leaving them at high risk of abuse and inhumane treatment. After initial legal action, CQC reinstated their policy to undertake inspections when concerns are raised about inpatients' care and treatment. A CQC complaint has just been launched, so we will see what happens. The Equality and Human Rights Commission legal challenge against the Secretary of State for Health and Social Care over the repeated failures to move people with learning difficulties and autism into appropriate accommodation. I am assertively requesting that the Equality and Human Rights Commission will reassume legal action with increasing frustration of delayed discharge of inpatients with learning difficulties and autism and locating appropriate accommodation in the community. I am hoping this legal action will include an examination of whether the Transforming Care Programme budget has been spent on moving individuals out of hospitals into community care provision. This includes hospital fees being used to fund community care placements. Free Our People Now campaign is now supported by People First, who has now issued their own statement calling for the closure of psychiatric hospitals and assessment and treatment units. Now I am finding, like myself, there are other people with learning difficulties and autism who are trying to get their mates out of the oppressive psychiatric system, which means Free Our People Now campaign must get moving from a crowdfunding page to an independent campaign during 2021. So watch this space. Free Our People Now.